We are having candid conversations with Dr. Lenore regarding pediatrics. Many of us in our practices have a number of patients and parents who are concerned about how this Delta variant is impacting their children. And we just wanted to get an expert in here to talk to us about what their concerns are, what our concerns are as it relates to, virtual time away from the actual classroom and what that may mean for their learning, what the impact of COVID has been on children, and what we should be sharing with our patients and their parents. Dr. Lenore, we're just going to lend you our virtual platform and let you have the floor. All of you, please be dropping your questions all along the way, because this is going to be a dialogue and more of a candid conversation. Dr. Lenore.
Unmute yourself, Dr. Lenore.
Am I unmuted now? Can you hear me?
Yes.
All right,
yes.
I'm sorry. Well, good morning again. Thank you for the opportunity to come and share some
recording in progress.
Some information with you. I'm very impressed at the number of people who are taking the time on a Saturday morning from very busy schedules during the week to join a discussion like this, and it puts a lot of pressure on me, and I'll try to do my best to be effective, efficient, and relatively brief. I think it's always good to have interactions, and I know a lot of you have not only questions, but probably contributions to make. What I want to do is to take you on a journey through the path of the coronavirus, especially in the African American community. I think the virus probably appeared, obviously in China. Everybody talks about that, whether it was human to animal transmission or it was laboratory based. I think it has not quite yet been decided, but it's kind of irrelevant. I believe the virus probably got here probably in October, November of 2019. But it was really only manifest once it was decided that in China, you had the virus spreading like wildfire in Wuhan. And so it first started to appear here. What's not really clear is where it came from. People say it came from China, but a lot of people feel it came from Europe. It went through to Europe, and Europeans brought it here, and that's one of the reasons people in New York had so much difficulty. To move rather quickly through it, in the first phase of the pandemic, nobody really knew what it was, and the African American community suffered greatly. We suffered greatly because we were the real first responders. When you think about who responds first to these things, it's people driving buses, working in nursing homes, doing janitorial services, and we were disproportionately in that particular population. In addition to that, we were as a group, and have been as a group, from the cradle to the grave, sicker than other elements in the community. African Americans have more chronic diseases. They're sicker with more chronic diseases, and mortality rates are higher. So the virus was first looking for that kind of person. So we were there first, and we were sicker, and consequently the initial statistics reflected that. So initially what we were dealing with the coronavirus. It is an RNA virus. It gets in. Viruses work by attacking cells, entering their nucleus, taking over the factory that produces that typical cell and making viruses. And they're very clever at doing that. And so we were dealing with the coronavirus. It was killing people, it was making people sick, and there really was no treatment. As viruses multiply at millions and millions of places, billions of places across the world, some viruses are defective. That means that, you can't, even if you've got the most efficient factory, you can't turn out a perfect product every single time. So that when you talk about variants, you're really talking about defective viruses that didn't have some of the same characteristics as the viruses they were trying to make. And so consequently, in that situation, then you had a number of variants. There are probably at least 100 variants. There are probably variants being made every day, but most of them do not have a particular quality that makes them any different from the regular coronaviruses, some less effective. But in terms of the Delta virus, it was a variant that has the ability to infect 1,000 times more infectious than the coronavirus itself. So consequently, it started in India. It was called the Indian virus, but the Indian government got rid of that quick and started calling it the Delta virus. And there have been other variants coming from South America and South Africa. But fortunately, those have not been nearly as productive as the coronavirus. It's the Delta virus. So the Delta virus, like I say, is taken over because it's much more infectious. In early January, maybe December of this year, we started a vaccination program. There are a lot of questions about the vaccination for a lot of people, even for a lot of physicians. How fast, what it was, how fast it was made, was it looked at enough? All kinds of questions about it. Well, I think you have to look at the coronavirus in a different light. Viruses are like trees. Trunks can be very similar, branches can be very different. So when you talk about coronaviruses, we've been looking at coronaviruses for 20 years. I throw myself in that scientific community because it gives me a little bit more, elegance. But so that the trunk of the coronavirus is really, of the COVID virus, is really no different from the trunk of a lot of other coronaviruses. And so consequently, in that circumstance, then when you talk about the research that's been done on the coronavirus, a lot of it had been done for many, many years. And so looking at the branches, that's what makes viruses different. And so look at the branches of the COVID-19 virus, it certainly had to be looked at, but obviously it could accelerate our understanding of this virus sufficient to make RNA vaccines. And these vaccines primarily block the ability of the virus to get into the cells to do the things that they need to do. So I think that what we've seen across the country, obviously, is the politicization of the whole process. I think which is extremely unfortunate. And then we look at the way in which the hesitancy issues have arisen, and the anti-vaccination movement all have slowed the vaccination of this country. Now, everybody's waiting for what they call herd immunity. And I think you have to understand what herd immunity means. That means before this virus, we have had lots of vaccines given to infants and children. And so consequently, if you had chosen before not to get measles vaccine, not to get mumps, and I had lots of legitimate discussions with parents concerned about vaccines. But in those days, you could get away with it. Why could you get away with it? Because everybody around you was vaccinated. And so consequently, that meant that you were protected. And so this discussion about hesitancy has been going on for a very long time. About 2 years ago, the state of California made it mandatory that you vaccinate your children. If children are not vaccinated, they're going to be facing the same thing that a lot of non-vaccinated people will face in the future. You can't go to school, you can't go to preschool, you can't do anything as a child unless your children are vaccinated. And that is the law in California and has been for the last couple of years. And so consequently, mandated vaccinations are not new to us in California. I think there are 8 other states that have a similar policy. And so the vaccination issue has raised a lot of questions, legitimate questions from African Americans about back to the Tuskegee study, legitimate questions about the research, legitimate questions about the way the vaccine works and what happens when the vaccine is given. And those are legitimate questions. People have to have questions. Initially, we were worried about older African Americans being vaccinated, but your grandparents and your parents are getting vaccinated. And so consequently, that we thought that once the vaccine was available, that would be a solution to the problem. Let me go back a minute and talk about the smallpox vaccine. We've had a smallpox vaccine in this country for 50 years, safe, effective, given all over the world. But the last case of smallpox was last year. So it took us 50 years to wipe out smallpox. And so this virus is don't kid yourself. This virus will be around for a very long time. And our only solution right now is two solutions. One is to get everybody vaccinated. And the second one is to get better treatment for those people who get infected with the virus. So now let's move to children. It's not unusual for children to be vaccinated. In fact, most of the vaccinations you get as infants or children. And so initially, the first COVID-19 virus was really not that effective against children. Infants have maybe a stronger immune system than you do, that they get from their parents and that they mobilize more effectively. And so consequently, they're a bit stronger. And as you get older you get a stable immune system. And as you get real old, I don't know what real old is now that I'm close, but if you get old, then your immune system starts to become less effective. Part of the aging process, when we see ourselves differently on the screen, and sometimes are amazed at how much different we look, is because your immune system is starting to change and function somewhat differently. And so consequently, giving vaccine to children is not a new thing. Now, what happened is that initially you couldn't do that. You have to do the experiment on adults, then you have to do it, and you have to bring it on down. And so consequently, they're starting to reduce the age group in which they could get the vaccinations. Initially, children had stronger immune systems and were not admitted to the hospital. There was a multi-system disease that occurred in a few children, but most children were pretty much immune. Delta virus shook its head and said, no. Oh, no, we're not going to leave these children out. And they started, so this virus does attack children. And it's not as serious an infection as it is in adults, but it has landed many children in the hospital. I had the numbers yesterday. They're staggering, the number of children that are being admitted to the hospital with the coronavirus epidemics. I did a small study in my office, because I did talk to a number of older African-American senior organizations, and most of them had already been vaccinated. But when you started to talk to the parents of my children, I talked to 15 parents in one day, 13 had not been vaccinated. And the reasons were all over the place. And so consequently, we have a real problem in communication. They're not listening to us in the traditional ways that they listen, but what they do listen to is they listen to you. They listen to the vetted sources in the community. If you're their physician or their pediatrician, they will listen to you. And they will at least consider it, and sometimes you can change minds. But I think right now we're in a situation where, the vaccine is being studied in younger children. I think will probably be released for children down to 5. Ultimately, it will probably be given to infants. That's where most vaccines are given. I think you're going to have to get boosters, just like you get boosters for other things. As an adult, you get boosters for pneumococcus, diphtheria, pertussis, and tetanus. As a child, you get boosted 4 or 5 times for some of the same vaccines. I got boosted yesterday because I want everything I've got fighting this virus. And so consequently, I think the booster issue is confused. A lot of people made them more hesitant. And I think we have to be concerned and considerate about hesitancy and be patient in talking about it. But I'd be interested in your opinion. How long are we going to put up with that? It's not okay to be unvaccinated. It's not okay to be walking around your friends and your family unvaccinated. And if you're unvaccinated, I can say without question, as an immunologist, you will get a COVID infection at some point in time. Because if you plan to go anywhere, there will be other people like you who are not vaccinated, or there will be vaccinated people carrying the virus, and you are going to get infected. And a lot of my patients say, well, I've never got nothing, I've been sick. I'm strong. That's the black male perspective. I said, I'm healthy right now, and I've never been sick, and this virus is not going to get me. Well, you've seen these deathbed confessions of people who said, I wish I'd gotten that vaccine. Because it's not just the hospitalizations and the deaths, it's also the residual of the infection, the so-called long haulers. 1 out of every 3 patients who gets a significant COVID infection has some mental issues for several months. They're not just mental, they're cardiac, and in some cases pulmonary. And so consequently, just getting the infection is not the end of the game. So consequently, we have a challenge in the African-American community, because when I looked at the last, I think it was like 14% of the African-American community has been vaccinated. It may be higher now. I haven't seen the numbers in a couple of weeks. But we have a real challenge. First of all, to explain, to understand the vaccine ourselves. Because as doctors, I think we're a little hesitant at times to get vaccinated. The second thing is to explain to your patients and your family and your friends the effectiveness of the vaccine in keeping people maybe not sick because you have some breakthrough infections, but very few people who've been vaccinated have died from this infection. Most of the 90% of the deaths are in unvaccinated people. And so we have a real job to do in trying to explain to our community. The real challenge for us as physicians is that even if we're 10 years out of the main game of parenting, the communication systems with TikTok, Clubhouse, and Facebook Live and Zoom, they're getting their information in a different place. For instance, and I'll close with this, 2 or 3 of my patients knew at least 3 people who died from the vaccine. Now in California, there are probably less than 50 people who died from the vaccine, if that many. But they know 3 people who died from the vaccine. That's 9 people in my practice. Now that's 100% of the people who died in probably the state of California. But that's the way the information is flowing. So we have a real challenge here. First, to understand and believe in vaccines ourselves, get vaccinated, let people know you're vaccinated, and then give your patients some information. At least ask them about the vaccine to engage them in a conversation. So I'd like to stop at this point and see if there's some dialogue we can start. I know it's a little early out here, but not that early. And so we'd like to see what you have to say about what's going on now.
Thank you so much for those comments, Dr. Lenore. I'm Rhonda Maddox and the President-elect of Arkansas Medical Dental Pharmaceutical Association here. As you've said, we do have, when we're having the conversations about the vaccine, I will have someone say, I know one person who died from, and they were fully vaccinated and they died. And my response to that is, one person who's died who was vaccinated. And if you look at the data, depending on when you started looking at it, it's maybe 2 to 9% of vaccinated people who have died, but there are 90 to 91% who have not died. Do you want to be in that 2%? Do you want to be in the group of people who die from getting COVID? And that could have been easily protected. Another thing that I'll hear sometimes is, well, I don't know what the long-term consequences of the vaccine are. But if you get vaccinated, you'll live long enough to figure out what those consequences are. Without the vaccine, you are going to get it. It's just when are you going to get it? But you are going to get it. And perhaps you will be out of here in 2 weeks. Last week, I knew 2 people in my immediate family who died unvaccinated, unfortunately. Now, they were in their 40s, children. So the conversations that I'm having now are not just about will you get the vaccine? I'll say at least 60 to 70% of people of color aren't vaccinated. So let me tell you about what to do when you get COVID. When you get COVID, have a gallon of water at your bedside because you're going to be too weak to go to the bathroom. When you get COVID, have something over there so you can poop beside the bed because you may be too weak to get to the bathroom or to the kitchen. Give someone a key to your home. Have cleaned up your house so that it does not look awful when someone has to come through and pull you out. Let people know where your paperwork is because you may die from this and you may die rapidly without your house in order. So start getting your house in order if you choose not to get the vaccine. And then people are, a little taken back by that, but it starts to put some things into perspective. So don't just have a conversation for get the vaccine. Recognize that there are going to be a number of people who don't get the vaccine. And if you don't get the vaccine, let's talk about being prepared and having your house in order because it is quite possible that you will die rapidly and nobody knows where your information is. Are you having those conversations, Dr. Lenore? And do we have?
I'm having all kinds of conversations. Okay. Because first of all, most of the patients many of the patients that I see, this is the second generation of patients. They were my patients as children. So now they're parents. And so I can just talk to them directly and say, man, listen, let me tell you about this virus. And I don't mince any words. The other part of that is there are a couple of other things that people need to start to consider. One is whether you can work. Because I think that a lot of people, a lot of companies and corporations are going to demand that you be vaccinated. And the reason they're going to demand that you be vaccinated because they don't want you messing up their workforce. You think it's because they're mandated. It's not because they're mandated. It's because they're business people. They understand that if you are unvaccinated, you're likely to miss work and spread it around to other employees. And so that you're going to start to see more and more. Here in my county in California, you cannot go into a bar. You cannot go into a restaurant inside. You cannot enter a lot of venues unless you show a vaccination card. And that is the rule in San Francisco. And San Francisco has a black mayor sister who's not playing, and she's never been playing about this virus. And so that's what they've instituted. You can't go anywhere. You can't go to work. You can't go to any entertainment venues. I've missed 3 or 4 people that I didn't even know came to town because, it's been such a lockdown. But I think that there's this issue of employment that African Americans have to be concerned about. And there's certainly the issue of being able to enjoy yourself, and it's starting to impact the quality of your life. And so that may be a more persuasive argument. And I think that it should be mandated. I'm just sorry. I don't think that we're going to get anywhere near enough people vaccinated unless there's a general mandate. And people talk, well, Biden should have gone further. Well, I'm not sure how much further he could have gone. How much power does the executive have to mandate that everybody in this country get vaccinated? But I think until we tighten those mandates, we're going to see surges, and we're going to see African Americans disproportionately, involved. Now, I've looked at all the studies because I edit a physician newsletter, and in almost every single study, any African American with chronic disease has a higher rate of mortality than others in the studies. Whether it's renal disease or diabetes or breast or prostate cancer, African Americans are dying more in larger numbers because they're not. When they get to the doctor, they're sicker. That's the first thing. And when they get into the system, and that's one of the reasons we started the African American Wellness Project. When you get in the system, you don't get a fair break if you're African Americans. I don't care if you're carrying a shovel or a pick or briefcase. If you're African Americans with any disease, including COVID, you're not going to get the same level of care unless you demand it. The system says that. My experience says that. Everybody says that. And there was this very, very touching video of a Black doctor in Indiana who was in the ICU, who was getting ignored and disrespected and treated differently, and she died. And so consequently, I think all of those kind of factors come together for us to be able to, for us to start to think about the implications of not being vaccinated, not just for you, but for your friends and family.
Those are excellent points. My question for you as it relates to children is, I had a very candid conversation with a teacher who said that they were seeing the loss of academic growth in African American children who are choosing to be virtually schooled rather than to be present in school, and how those children have checked out and aren't necessarily as engaged. And so just showing line after line of children who started at one point at the beginning of the year and actually lost ground when they expect you to gain ground. What are you saying to the parents of children who are trying to make the decision because their children are not of age to get vaccinated, and they're concerned about them losing ground versus them getting COVID?
I don't think anybody ever expected that virtual learning would be equivocal to in classroom learning. And so I think that obviously you don't need a study for that. There's some children who checked out in virtual class, in-person learning. And so consequently, you certainly don't expect those children to be as well educated. I think the estimate is that most children have lost at least 6 months to a year. And I think that's kind of what you expected. I do think this, though, that a lot of parents who are anti-vaccine and who want in-person learning really want the teachers to babysit their children. I mean, that's one of their biggest motivations. They don't really care about the educational process. Because if you do, you think about it. It's like I talk to patients who have asthma, for instance, and I talk to them about medications. And I say to them that you want to reduce the amount of medicines that you take. And I agree with you. But unless you do take the medicines away, I tell you to take them for at least a couple of months. How can I reduce your medicine? And at the end of the day, you end up using more albuterol or more of the other medications because it's not called non-compliance anymore. You can't say that. Yes, it's non-adherence, but they're non-adherent to the structures that are in place so that I won't be able to reduce the thing. And the same thing is true about schools you put a child in an in-person learning that does not have adequate protections, does not have children not wearing masks, the parents have not been vaccinated, then they're going to be out of school. We have had to take children out of school, and I don't know if this is your experience in your region, but we've had to take children out of school because they have runny noses or they cough once or twice. They send them home. They send them home. And so consequently, we have to get them tested. You have to give them notes to get back to school. I would say that's 25% of the children I'm seeing right now. Most of them don't have a COVID infection, but they have a cough or their nose is running or they look a little strange and the teacher send them home. And I don't, it's hard for me to blame teachers who want to be protected. And I'm telling you that there's a very strong component of the anti-vaccine group who just want the school to babysit their children so they can go to work and do whatever they do. And now we're starting to recognize the importance of the school and childcare.
Absolutely. We have a couple of questions in the chat. One is, do you have any information on Cuba's COVID-19 vaccine? And the other from the same person is, and also, is there any information on beta glucan and its use on kids, on virus in kids?
I can't answer the second question. I'm going to do something that experts very seldom do. I don't know. That's the first thing. I did see a special on Cuba, and initially Cuba had lower rates of vaccinated people than other countries. Now, I don't know which vaccine they're using, but now they're very concerned about the surge in Cuba of unvaccinated people. Any one of the Caribbean nations, if you look at any of their rates of vaccination are probably less than 15% in almost all of the countries, with the exception of a few who've taken very strict measures. So but I did see this special on how the pandemic was being controlled initially in Cuba, but more recently has surged in some of the certainly the outlying areas. I can't hear you, Dr. Matt. I think you're muted.
Okay, great. Next question. People have died because of an adverse effect. Please clarify. People have died because of an adverse effect from the COVID vaccine, in contrast to people have died because the vaccine did not work and they got a COVID infection and died. I do recall a few years ago that people developed Guillain-Barré as a complication of the flu vaccine, and maybe some of them died from the Guillain-Barré, therefore died because of the flu vaccine.
Now, I think that there's very few, I haven't heard of very many cases of Guillain-Barré. I think the big issue was whether or not people with allergies could take the vaccine. And I think that, let's start first with this. When a vaccine is 90% effective, right, that means it's 10% ineffective. So you expect people who have gotten the vaccine, at least 10%, I think it's 1 in 5,000 now, but you expect some people who get the vaccine not to be protected. Even in the studies, the vaccine of 95, let's say it's 95%. 5% of millions of people is a lot of people. And so consequently, you do expect some people not to respond to the vaccine. That's present in the studies. So that was the first part of the question. As an allergist, I can tell you that the people who have problems, who had high risk for problems, and there've been very few allergic reactions across the country, I don't have the number now, are those people who reacted to flu vaccine. And so the only thing that we can do as allergists is we can test for polysorbate, because it's a component of those vaccines. And so we've tested probably at least 30 people, and we've had about 5 people who tested positive. And in those instances, we desensitize those patients by giving them small doses of the vaccine and then increasing the doses until they're fully vaccinated. But there are very few reactions, allergic reactions. And if you have regular allergies like hay fever, sinus problems, food allergy, you're not at any greater risk of getting this vaccine. But there have been some adverse reactions, as you would expect in anything. There are adverse reactions to aspirin. There are adverse reactions to Pepto-Bismol. I mean, there are adverse reactions to almost anything that you take. I dare you to go to the cabinet, look at the medicine you're taking, and read the potential side effects. So to expect that there will be some problems in certain people who are vaccinated is somewhat unrealistic.
I agree. Please drop additional questions in the chat. What are you seeing as it relates to children and parents in terms of mental health, the toll on their mental health there?
Wow, I mean, that's a big question because, my children are grown, but if I had to be stuck with them here for a year, I don't know what kind of mental shape I would be in. My grandchildren, I love them. They came for a couple of weeks. They stayed with us. Hey, look, it's a real challenge. Can you imagine what it's like to be in a household with 2 or 3 children who were there all the time, trying to get them educated, trying to get stuff for them, being concerned about what's going on. My wife and I have been married for 36 years, blessed years, this last week. We probably had 2-3 arguments before the COVID epidemic. We probably had, because, we're passing in the day, passing. And look, since this epidemic, we're not battling, but look, there's certainly a lot more tension at times in the house. And the problem is that there's really no release for that. You know what I mean? And Black women especially are burdened by this whole process because, we kind of kick back and we kind of sneak out and go to golf course and do a few things. But in my practice, there are very few very few women who have been able to do that. They've had to do everything. And I think that the tragedy is even before this, there were not enough mental health services for people. And I think it's really important in any region. One of the things that we can do as organized Black doctors is to help people understand where they can get help when they need it. Because there are a lot of help situations out there. One of the unfortunate things is the government has given out a lot of money for education. They've given a lot of it to ministers and community organizations. But Black physician organizations hardly have gotten any money to do anything. And so I think that one of the things that we need to do is we need to organize in such a way that we can identify mental health services for African Americans, because they're very few and far between.
And the psychiatrist in the group said, amen. I did not pay him to say that. We have never met until this day. Thank you so much, Dr. Lenoir, for saying such brilliant and genius remarks. We have another question. How long do you estimate before the SARS-2 COVID vaccine is mandated for children to attend school?
I would say a year. I mean, first of all, you have to get it down, school-age children. But I would say what's going to happen is, and what's already happening, school districts are experiencing surges in the virus, children having to leave, teachers dying. And I think once all that kind of comes together, it's going to be probably about a year, and I think it's going to be a mandate. But here in California, I'm telling you, you cannot go to school, preschool or any other school, unless you're vaccinated up to date. And what's funny about that, Dr. Maddox, is that before that, I went all these discussions with parents about vaccinations and want to get out for religious reasons, and want to let me give him this vaccine on Thursday and another vaccine next week, give him half a dose, let me see the vaccine vial. Once that law passed, I've not had one parent to object, not one. I mean, there's been no movement against the state once they did that, once they mandated that either. But I think mandate, it's going to be about a year.
It's unfortunate that this is so politicized. Before COVID, it was nothing for you to hear people talking about, are you going to get the flu vaccine this year? I hear it's going to be a beast, or, are you going to get your child the HPV vaccine? And so we talked about it openly. Unfortunately, with leadership, with previous leadership, it politicized things so highly that now if you ask the question, have you been vaccinated? People are completely offended when you ask those questions and different things. Now in Arkansas, it's a little bit different because, or at least that's what I'm being told by some of the children's parents, is that one child in the house tested positive, another child in the house tested negative, and they wanted them to come to that school because they get dollars based on, bottoms in the seat. And so they are actually encouraging children who are even in the presence of active to come to school. And that was just very surprising to me. I had someone trying to talk to me about what should I do. And I said, this child lives with his grandparents. What you do is you protect your parents.
Right. Well, whatever forces in the universe that control things like this, just laugh at this kind of politicization resulting in that kind of behavior on the part of a school district. Because what's going to happen is, some of these children are going to get sick, their parents are going to get sick, the teachers are going to get sick, and consequently, the healthcare workers who are not vaccinated are going to get sick. And as they start, we've had about 5 or 6 right-wing talk show hosts who died from coronavirus. One of the things we know, and I know for a fact, is that a lot of people who are talking about you not getting vaccinated are vaccinated. I mean, I don't care what you say, they're vaccinated. If you don't believe some of these big time talk show hosts are vaccinated, you're absolutely wrong. And there's probably policies, underground policies with that. So consequently, I think that that's it's going to be difficult to avoid that. The virus will tell you what you have to do.
Absolutely. We have an additional question. What are you seeing with monoclonal antibody use access in the community? Let's talk about what a monoclonal antibody is. It's once you get sick, the antibody can attack the virus. And there are very encouraging signs of monoclonal antibodies that are very specific for any kind of coronavirus. There have been some studies that show that some of them are very aggressive and will be available and will be probably game changers in terms of treatment of patients with coronavirus. But let's go back to what I said before. You and I both know, all of us in healthcare know, that African Americans are not going to get the same treatment that other people get. I mean, like when Trump went in the hospital, he got antibodies, he got chocolate, he got everything. Now, when you go to the hospital, you're still Black. I don't care. I mean, I've been a doctor a very long time, as you can see from my resume. And I've never seen a time when African Americans were treated the same. Every day or every other day, somebody calls me about a situation. Either they're in the hospital and nobody talks to them, or they can't find a doctor that will accept their insurance, or they were disrespected. Now, you have to build your own healthcare system if you talk about, what's going to happen. So you're right about monoclonal antibodies. It's very encouraging, but we have to be advocates for the African American community to make sure that we get the same treatment, that we overcome unconscious bias in the system so that we get the latest treatment and not yesterday's treatment that didn't work as well as today's. And this is concerning because with COVID, it means that you don't have people at your bedside to hold the providers accountable like you could beforehand. And I think that may be why we're seeing, particularly in our communities, an increase in maternal mortality around the reproductive issues. And our Dr. Nash says this is a continuation of the health equity efforts and health equity discussion, really.
Yeah, let me talk a little bit about that. Health equity is just a term that we've been dealing with. When I was president of the National Medical Association, we talked about health equity. That's the difference between what our community looks like health-wise and what other communities do. All right, with George Flood, of course, we got hot. We're going to take care of this. We're going to do something about the police. We're going to do something about the differences between Black unemployment, housing, and all that. I bet right now you could not gain, unless you're in the Black community, and you ask somebody who was that guy that died in Minnesota at the hands of police, they won't know his name. And I can tell you at the end of the day, by this time next year, we'll be right back to the same system. Right now, we're hot. They're giving out money for this and that and education and all of that. Now, I've always believed this, that we've had healthy people 2000, 2005, 2010, 2015, and yet still the gap between the health of African Americans and other Americans is different. And so consequently, our feeling is at the African American Wellness Project that you've got to change health equity from the bottom up, not from the top down. You have to be a prepared person. You have to know how to navigate the system. You have to have an advocate. I'm glad you mentioned the term advocate. If you don't have somebody watching that IV when your mother's in the hospital, or watching the nurse come in, or having her ring that bell and nobody come, if you don't have an advocate when you go into the system, they talk to you about all the things you have and you don't understand either the disease or the medicine, you're not going to get the same outcomes. So our belief and what we will try to do is to give you the tools so that you can build up your own health system. I mean, I'm not going to spend a lot of time on this, but selecting your primary care doctor, that's critical. I mean, if he's not available and he's disrespectful, the office is disrespectful, get rid of him. Get rid of him now. Get another primary care doctor that suits your personality. When you go in there, be organized to talk to the doctor about what you need to do. I mean, what do I have? And if you don't understand, like the ladies always tell me, I don't understand this big doctor talk. If you don't understand the big doctor talk, then you need to get somebody to go with you. And when you're in the hospital, get an advocate right away. Not your cousin or your brother, somebody who knows something about health. Could be a medical assistant, a nursing aide, somebody who knows what to ask these people when things don't go right, or who knows how to demand in the system. And as a doctor, I used to have a tantrum every 6 months. So people that knew that when my patients came in there, if these things went wrong, this was what was going to happen. And so when we talk about health equity, we're talking about from our perspective, we're talking about building your system from the bottom up, not waiting for the top down to do what they've never done and what they'll forget to do by this time next year.
I have parents ask questions about how do we build natural immunity for our children so that we can avoid this. And of course, I'll have a conversation about building your immunity, but it's not so we can avoid getting the vaccine. What are you telling parents in terms of boosting their immunity, boosting their children's immunity, not necessarily to avoid the vaccine, but just in general?
I would say that you have a very sophisticated immune system from the time you're born to the time you die. But viruses have been around billions of years. They understand what they have to do to survive. And they would gradually understand how to overcome aspects of your very efficient immune system. So I don't care how strong your immunity is. You have to recognize that the immune system is very complex. It's not just about antibodies. We've all talked about that, but it's about your physical condition. That's part of your immunity. And there's certain kinds of immunity that are what we call non-specific immunity. That's your white cells and the other things. Then we get to your antibodies, but it's not just your antibodies that are specific. They're what we call T cells. So there are lots of elements in the immune system that come into play when you get an infection. You can shore up your immune system, but these viruses have seen it all. They've been here for billions of years. They were first here. They understand. And this coronavirus understands what you're doing, what you're giving vitamin C and wheatgrass and ginkgo biloba and all that. The virus sees all of that. And it sees it. And so I think you should do things, making sure your children have a healthy diet. Certainly it looks like to COVID-19, to a lot of our children mean they gained 19 pounds during the COVID virus and inflammation. Obesity puts you into an inflammatory situation. So if you're overweight, then you are in an inflammatory situation already. So that affects your immune system. So just your general health, exercise, and good diet. And certainly you can, I'm one of those physicians that really believe that non-traditional approaches to health are very important. And if you've got something that you like to do or something that you like to take that boosts your immune system, by all means, take it. But realize that this virus kind of understands that. They've been around a long time.
Mm-hmm. Mm-hmm. Absolutely. As we're almost about to wrap up, I'll end with this question. What are you saying about the long haul COVID that we're seeing? And what are you telling parents? When I first started seeing it, I really was having trouble with getting people to sleep because the traditional means to get people to sleep was just not working. Is that what you're experiencing there as well? And just talk a little bit about what you're seeing on the long haul side, particularly as it is with children.
Well, I don't think the children, I haven't seen much long haul with children because their infections we haven't really been, the numbers aren't there just yet. be interesting to see what data comes out about that. I haven't seen that, I hate to say it this way.
I can no longer hear you, Dr. Lenore, if you're talking.
Sorry, can you hear me now?
I can't.
I hit the wrong button. Look, I've been the single father of 4 children. And so I got street cred on this. You can't tell when a child